Okay, everyone, welcome. It's Saturday, February 26, 11 a.m. So if it's a Saturday, 11 a.m., you guys know it's webinar time. I'm always excited to be joining all of you on a Saturday. I know you're taking time out from your friends and family and all the amazing things that you can be doing, but we're excited to meet you and chat with you. So come on into the room, get comfortable, pull up a chair, have your coffee or your green tea or whatever your beverage of choice is. We're going to talk for probably just under an hour. And we're going to share lots of good information with you. In the meantime, as people are starting to come into the room, take an opportunity in the chat thread there and just let us know who you are, where you're from, and what you do. So really easy. You just say, my name is Joe, I'm a PT, and I'm from New York City. So you can just say something like that. And if you are a clinician, obviously let us know what type of clinician you are. If you're someone who's looking for a solution to a chronic health condition, we welcome you here as well. Obviously, this webinar is intended for professionals, but you're more than welcome to stay here with us. Hey there, Lynn. Welcome from British Columbia. Hi, Judy. Hi, Michelle. Hi, Melissa. So everyone just come in. This is going to start to roll really fast. Hey there, Deb. Nice to see you, and I'll see you in a couple hours. One of the things I always love about these webinars is people from all over the country here and all over the world, actually. So you see lots of different states. We have Italy, we have Quebec. What else do we have here? Nova Scotia. Hey, Fabio from Italy, ciao. Delaware, Chicago. So just let us know. Australia, it's 3 a.m. We always welcome our Australian colleagues on the other side of the world. I know you usually watch this on a replay. So if you're here live from Australia, we value you even more, and thank you for being here. So I'll give people a couple moments to enter into the room here. And then we'll get started. Someone from India. Wow, welcome. In a couple of minutes, you'll meet our co-hosts here for the day. I'll introduce you to Cheri and Rose and Jeremy and Annette in just a couple of moments, and they're going to talk as well. So they're going to help me, run this webinar today, and they're going to share lots of great information with you. Someone from France, welcome. And most of you know that I'll have some slides to share here. So I'm going to bring up the slides now. And I'm just going to minimize this. Okay, we got 30 more seconds and I'm going to kind of get started. All right, everyone. So again, a warm welcome to you and thanks for being here. If you're watching this in the replay, we miss you, but we're here with you kind of in spirit, and we look forward to any feedback you have for us about today's webinar. As I mentioned before, I'm going to talk for a little while, and then I'm going to introduce you to Cheri and Annette and Jeremy and Rose in just a couple of minutes. And I'll give you just kind of a brief agenda of what we're going to do on today's webinar here. So just a really brief overview of where we currently are with pain, because obviously the care and rehabilitation of pain is just moving and changing so fast, and we're all keeping up with that. The focus today is really to talk about psychologically informed care. So we're going to talk about all the different pieces of that. Again, an opportunity to meet our faculty and mentors. We're going to share with you some of the projects that we're working on. So we're thinking about as far as research and other courses and books. And we're going to have plenty of time at the end for Q&A and then some further next steps. So as I mentioned, you'll meet Annette Willgens from Temple University, Cheri Rothschild from Central Florida University, Rose Pignataro, who is at Emily and Henry University, Jeremy Fletcher, who used to teach. Now he works for an amazing not-for-profit behavioral health recovery center called Veterans Resources Recovery. And then again, I'll speak. So you'll meet my great co-host in just a couple of moments. But first, let's just touch base on the role of psychological processes in the development and maintenance of chronic pain. So big topic, right? So just the field of psychology is huge, but in our case, we're looking at how we can use psychological processes or psychological components to help people recover from pain and just to promote their general well-being, right? We're all very interested in how we can help people promote their physical as well as their mental well-being. It's a big topic that's happening all across, of course, the globe post-COVID, and especially within the world of chronic pain. So you can look at these psychological processes first as kind of like these general processes. So these are things like social isolation, which we encountered over the past year or two, childhood trauma, which I think a number of people are going to touch on today, just a general negative affect, right? So it's kind of like more kind of 10,000 foot view of like general variables that impact pain from a psychological perspective. Then you have kind of the more pain specific variables. And these are the ones that you're starting to read about in the research. We talk about them on my podcast. You're probably coming across them with regard to patient intake forms, things like catastrophizing or pain catastrophizing, self-efficacy, motivation or enhancing motivation, mood. Typically, we're talking about anxiety or depression, but PTSD and trauma falls in there. Things like traits, like mindfulness as a trait in people and how we can train that. And then the broader picture of cognitive skills or cognitive behavioral skills, which really the word cognitive behavior really fits into every category at this point. What we do know, what the research is pointing towards, is that there's obviously a lot involved here. This is very complex, and it varies from person to person based on the individual and based on their lived experience. So no two people have exactly the same pain. And the trajectory of how their pain developed and to how we reverse their pain may be different depending on who that person is and what they have gone through in their life. Now, if I asked you which psychological factors most influence the trajectory of pain, and just take a moment to, kind of do a knowledge check on yourself right now. And what are the most important factors that influence pain and their trajectory? Some of you might say, well, it's fear. When people are scared of pain, they avoid things. And, that's really it. They start to catastrophize. That's what the research shows. What's awesome about research is when we research things, we take these single constructs, right? Like fear, like pain catastrophizing, like avoidance, like the reconceptualization of pain, and we study them. But the truth is, there are so many different factors, that trajectory. Like, look at all the things that we have to learn to evaluate. In some ways, we learn to treat, and obviously we learn to take into consideration when we're helping build out someone's recovery plan. And that recovery happens obviously in the clinic with us, but more importantly, it happens when they're out in the social sphere, when they're working with their friends and family and, returning to work and meaningful activity. So the truth is, there's not just one, right? There's many, and it's our job to figure out what are the most salient features, right? What this really points to is that this idea of a single intervention for treating pain, we're really way, way, way past that. So someone emailed me the other day about something and they said, yeah, I started studying, I can't remember what it was exactly, some type of technique. And I really think this is the one. I think this is the one that can help people. And it's normal when you first start to study something, you want to go deep, right? Learn as much as you possibly can. But the evidence is pretty clear that if you're just using a single modality to treat pain, you're probably not taking someone too far. And really what we need is to identify what are the methods that are most used or most useful to us as clinicians, and obviously most useful to patients to return them back to the life that they want to live. This has been talked about in literature. I don't think it's talked about enough actually in professional circles. But multimodal pain management. Now, yes, you see that in multidisciplinary pain settings, but we don't have enough of those, right? I believe the correct stat is we have one multidisciplinary interdisciplinary pain management program for like every 1.2 million people in the United States. And that's probably similar around the world. So looking at how we can train single providers to deliver multimodal pain management especially within the PT profession, this is really the direction we're heading quite rapidly, because in a lot of ways it's more economical, and it may be more accessible for certain patients depending on where they are in the country. And then, of course, telehealth has changed that as well, right? So now people can access you from different places. So psychologically informed practice is not necessarily a new concept. It started within the PT profession probably about 15 years or so, has existed in other professions like OT for a long time, but it's basically starting to look at, okay, how do we move beyond the find it and fix it approach? And when we move beyond that find it and fix it approach, we realize that we need to take into consideration the cognitive, behavioral, emotional, and health approaches in treating pain comprehensively. Now, you may not use every single one of them in every moment of every day, but you start to use them and pick and choose and start to overlap them so you can individualize interventions that address both the physical as well as the psychological, right? So we're not leaving the physical behind. Don't lose that. I always tell therapists, like, you still need that, but start to weave in the psychological component to it. Now, when we look at these essential components, I really see these as essential components. There are 7 that I believe that are essential no matter what type of practitioner you are. So first, it's really understanding pain and knowing how to evaluate different types of pain. So whether it's nociplastic pain, whether it's central sensitization, just seeing what type of pain is it, understanding what that means and how to evaluate it and discern from the different types of pain that are out there. There's always an aspect of cognitive reappraisal that happens with that once you start to educate patients about pain. Sometimes that reappraisal happens on its own, but most often we have to help people with them reappraising that pain does not mean damage, and they can still move on even if they're encountering a little bit of pain in their day and they're not hurting themselves. But we appraise not only the physical pain, but we also reappraise the distress, right? The anxiety, the fear, the depression that people are having as part of that overall picture. Now, when you're struggling with anxiety and depression and trauma, sometimes the motivation to change can be low. So a big part of what we can do as professionals in each of our treatment sessions is figure out, how do we enhance one's motivation to change, right? So just because you, let's say, explain pain to someone and they find it interesting and maybe it helps them reappraise a little bit, we still have to find ways to motivate them, because oftentimes knowledge doesn't necessarily overcome fear per se, right? So here are the motivational factors that come in. Now, as the motivational factors come in, we have to make sure that we're motivating people in a way that's trauma informed. I think when I look at the numbers on trauma as it relates to chronic pain, personally, I think they're extremely, extremely low. I think they're understated in the literature. And of course, they're under-recognized in primary pain practice. So trauma-informed care is a big piece of this. What weaves in really nice with trauma-informed care is mindfulness. So you have traditional mindfulness approaches, and then you have kind of the more mindfulness approaches that they've weaved into kind of like a cognitive behavioral construct like acceptance and commitment therapy. So mindfulness, psychological flexibility, very similar concepts, slightly different, but still needed to help people overcome pain. And then finally, and this is why I really wanted to introduce you to this group of people specifically, is once you have these skills and you've kind of started to embody these skills in your practice and yourself and even in your life, how do we start to mentor others? So mentoring PTs on your team that you work with. Sometimes you come across a patient who becomes very interested in this and you can mentor them to be a peer, or potentially they even wind up taking their career toward health coaching or maybe become a PT or a social worker. But I think the clinical mentoring portion of this is extremely key. So basically it means I have these skills. How do I help translate these skills so we can help really the world, right? We want to help the globe overcome pain in a lot of ways. You may be working from that on a small perspective in your clinic, let's say, but the people you encounter then go out into the community and then talk to their friends and family. So all of you in a way are mentors. with that, I want to introduce you to probably 4 people that I think are top-notch mentors, especially in the world of pain care. And I mentioned their names before. I'd like to first start. So we're going to kind of go in order here. I want to first start with Cheri Rothschild, and I'm going to stop sharing so Cheri can speak. And so as I mentioned before, Cheri is a doctor of physical therapy. She's a full-time professor at the University of Central Florida, where she teaches, of course, in the physical therapy curriculum, but specifically, she's created one of the first pain education courses in DPT school, which is incredible. So Cheri, welcome. And I'm excited to share you with our group here today.
Great. Thank you so much, Joe. It's an honor and a privilege really to be here with you all, because I think an opportunity to share this type of information with people who are like-minded is wonderful. Like Joe said, I do have the privilege of teaching a 12-week course on pain science to my DPT students. And a lot of what I do teach in that particular course is what you'll find in the pain education and cognitive behavioral therapy course for chronic pain as part of the psychologically informed care certification. So I think it really lines up with the slide that Joe put up with those 7 components of what psychologically informed care is. And the first one being understanding and evaluating pain. And so in that, and the course that I have created through the Institute, it's a 6-week course. And by the end of the course, you'll be able to comprehensively assess and really understand pain from a biopsychosocial approach. I think as a healthcare practitioner, it's really essential that you have a good grasp on what pain is, and then how can you best assess it in your client base. And then secondly, at the end of the course, you'll also be able to integrate some of the interventions that Joe has mentioned, and that you'll also hear about from our other panelists, as far as integrating some of those other 7 components that Joe mentioned. So ultimately, I think most of you are probably here because maybe you feel that you haven't been successful in managing your patients with chronic pain thus far. And in the field of physical therapy specifically, at least in the United States, the American Physical Therapy Association is undergoing a revision of the Guide to Physical Therapy Practice. And what's going to now be included in this next revision is a lot more language and specific objectives that relate to pain care. So I've had an opportunity to sit on the panel that has been presenting this information to APTA. And you're going to see a lot of these things being part of the Guide to Physical Therapy Practice in the United States. So I think taking the step of becoming a psychologically informed practitioner for chronic pain is going to align very nicely with where DPT curriculum, anyhow, in the US for physical therapy is headed. So I think that starting with the pain education course is learning more about pain. You're going to feel more confident. You're going to have some of that psychologically informed understanding of all of those individual variables and individual differences that go into the pain experience, learning about the different mechanisms of pain that individuals present with. They may present individually, or they may actually have those mechanisms concurrently. And then really putting forward some of these evidence-based assessment measures that we know are most effective for figuring out what's the driver of your individual patient's pain experience, and really tailoring your interventions to address that. I think it'll help you feel less frustrated with your current conventional plans of care that maybe are not working, maybe focusing more on that biomedical approach and chasing the issue being in the tissue type of approach, which we know is gone. We shouldn't be doing that any longer. And I think it's really, I feel super excited. I'm excited to teach my students about it. And I think my students then are excited to teach the clinicians that they go out and work in their clinical internships. I would say 9 times out of 10, students are asked to do their in-service presentation on pain education or pain science or something related to what we're all talking about here today. I think that is exciting. I think that clinicians are excited. And the biggest thing, I think, is offering hope to the patients that have been in chronic pain and have sustained many different types of interventions that just haven't worked. So your results will be, after taking this course, at least my pain education course, is to have those solid understanding of basic concepts and mechanisms of pain, as well as having access to some practical evidence-based strategies to really talking to your patients about their pain experience, starting with some therapeutic alliance, and kind of having that talk about pain in a different way that's not focused on the body tissue itself. And then you'll get a basic introduction to some of the lifestyle medicine approaches and modifications, including some of the things that Joe mentioned in his 7 core list of things for psychologically informed care that you can start to integrate in the next day that you said that you work with some patients. And it might just start with breathing. It might just be something to calm down the nervous system that has never been tried with a patient before. So I'm super excited that you're considering this certification. And I think that there's a wealth of knowledge to learn in each of these individual courses. Some new things that I'm working on personally is expanding pain education at my institution, not just to the physical therapy profession, but doing some interprofessional events with College of Medicine and nursing, and really getting some of these other healthcare providers and their students on board with psychologically informed care. And I'm working on a grant application to integrate more behavioral health into DPT curriculum, starting with my institution, and then hopefully applying for some grant funding to really make this go broader, and so that we can have more behavioral health in PT education. Again, I think it aligns with these upcoming, what was just published, the Pain Education Manual through the American Academy of Orthopedic Physical Therapy now recognizes that it should be part of DPT curriculum. And then the organization as a whole, the APTA, again, here in the United States, really providing that in the basic guide to physical therapy practice is being competent, psychologically informed pain practitioners. So I am super excited you're here, and I thank you for listening, and I look forward to any questions or comments that you might have coming up.
Thank you, Cheri. So if you have questions for Cheri, you can post them in the Q&A. We will answer them toward the end of the webinar. As Cheri mentioned, she is part of this overall certification. She teaches the pain education course, which also has a key component of cognitive behavioral therapy in there. What I love about that course is she kind of goes through the science, then through the pain education, then connects it in a way to cognitive behavioral therapy. So it's kind of like a double whammy in that course, which is awesome. Next up is Rose Pignataro. So Rose is a full-time professor at Emily and Henry University in Virginia. What's really interesting about Rose is she has a PhD with a focus on behavioral health, specifically with regard to motivational interviewing. Rose is one of the few PTs that I know who have actually helped people use behavioral interventions to wean off of substance like tobacco use and cessation, which I think is really interesting and an innovative place. So Rose teaches the motivational interviewing for chronic pain course here at the Institute. And again, that is part of the overall certification. So without further ado, I introduce you to Rose.
Thanks, Joe. Thank you, everybody. I'm really excited to be here with my colleagues, especially as Joe explained how all of these pieces really fit together in terms of multimodal pain management. I'm excited to be able to teach motivational interviewing within the framework of chronic pain because of the fact that very often our clients and our patients who have chronic pain find that they're very disempowered. The experience of chronic pain changes people's self-perception. It changes the way that they see their role within their family, within their vocation, even within their social life. It may change their interactions with other people. And it's also a very hard thing to describe. And so individualized subjective experiences of pain are hard to communicate with other people. And you often feel like nobody understands where you're coming from. At the heart of it, motivational interviewing is very empowering by contrast, because it invites the patient into a conversation as a partner, where the physical therapist or the other health practitioner might be seen as an expert in his or her own field. Like for me, social and behavioral theory would be my expertise. The patient themselves is the expert when it comes to the pain experience. And so by inviting them into the conversation and into the plan of care as an equal partner, we're really taking advantage of the experience of both the clinician at more of a health related perspective and the expertise of the patient. What does this person need in order to empower them to take better care of themselves, to take control over the aspects of pain that they have influence over? And so for me, that's one of the most exciting things about motivational interviewing. And, as Joe and Cheri were talking about, there's a lot of lifestyle factors and things that will be under our personal control if you're somebody with chronic pain. And being able to frame that in a way that allows people to see what they can do to help themselves really helps to restore some of the quality of life that can be lacking. It allows us, by asking these open-ended questions that are part of the communication style that goes along with motivational interviewing, it allows us to get more insight into perhaps some of the trauma that people have experienced, some of the reasons behind the fear that might be associated with the pain. Also, a better understanding of how anxiety arises, and allow the patient some understanding of how their mood and anxiety influences the intensity and the experience of the pain. And so it's really more of this bidirectional approach to, how does my mood and psychological outlook affect my physical capabilities, and how do my physical capabilities weigh in on the psychological aspect, and even in some cases, the spiritual aspect of things. And so one of the things that the course teaches is motivational interviewing takes practice, but there is a spirit and substance to motivational interviewing that can very easily become part of the types of conversations that you have with the people that you're working with. It is kind of intuitive in a way, although there is a very deliberate structure to it where the patient becomes the center of attention, so to speak. Instead of me telling people what they need to do, I'm listening from them what they think they should do, and also allowing them to investigate certain options that might not be within my frame of reference, but still be very valid. It traditionally has been applied to things like substance use. It's actually where it came out of originally. Two psychologists, Miller and Rolnick, used motivational interviewing originally to help people who had substance abuse issues. And so sometimes that's how I also use it, but it can be easily applied to things like exercise adherence, nutritional choices that we have, even, just general physical activity, not even deliberate exercise, getting yourself up and out in the world when you're experiencing chronic pain. When you engage your patients this way, it becomes less frustrating. Cheri mentioned that when you take a very, the traditional biological approach to pain, we're missing out on other aspects that influence the outcomes. And we became physical therapists or other types of health practitioners so that we can help people. And when we can't help people, it contributes to our own burnout. So what I'm hoping is that this reduces practitioner burnout, and it enhances and optimizes our outcomes for our patients. And, for me, it has increased the amount of reward and satisfaction that I gain from working with people. In terms of where I see this going, I did start out with motivational interviewing as part of my PhD to teach people how to overcome tobacco use. And now I'm getting interested into how motivational interviewing affects patient resilience. So that's one of the projects that we just completed. I've been doing more qualitative research where you're getting at the lived experience of the clients, but also the lived experiences of the clinicians. So we just wrapped up a research study on resilience in people with disabilities and chronic pain, looking at that from the perspective of the client. And right now we're completing data analysis on a study where we actually interviewed physical therapists to see what the physical therapist perspectives were on how to strengthen the therapeutic alliance or the rapport that exists through our communication with the patients and clients that we work with. So I'm really excited about those things. I think these courses fit together beautifully. I wish that I had something like this when, I was a physical therapy student. So I'm excited with what Cheri's doing. My students are learning motivational interviewing techniques and pain education techniques as part of their health promotion and wellness class. And as a clinician, I'm very excited about the direction that our profession is taking. And for us to be on the cutting edge this way in terms of multimodal psychologically informed care is really, really something spectacular. This is very innovative. So I'm looking forward to see where it goes.
Great, thank you. If you have questions for Rose, again, you can put them in the Q&A. Of course, we'll take questions toward the end. Speaking of innovation and someone who's ahead of the curve, I'm super excited to introduce you to Dr. Jeremy Fletcher, who is a physical therapist. At one time did work as a full-time faculty member and has now moved into the not-for-profit sector. And he really is in a key leadership position at a company called Veterans Recovery Resources, which is a behavioral health clinic that helps veterans overcome both obviously the physical and the emotional challenges that they're facing. He does teach the trauma-informed pain care here at the Integrative Pain Science Institute, and I'm excited to introduce him to all of you. Jeremy, mic is yours, brother.
Thanks, Joe. It's so amazing to sit here and listen to this group of people that have been assembled around this particular topic. And as I was listening, what I was reflecting on was my own pathway through, physical therapy practice right out of school, and then also what led me to become a physical therapist. And when I was listening to what was saying here, I remembered some of the reasons why I went into physical therapy to begin with, and that was one, I grew up in a household where my mom was an addict and ended up taking her own life because of chronic pain and fibromyalgia. And then I was also an athlete. And, so I had my own experience with injuries, and I didn't feel like I rehabilitated well enough because I didn't have access to the physical therapist that really had the skills necessary to do that. And so it really motivated me to go find out more. And so that's what led me into this field. And then to go on active duty as an Army physical therapist, and to really be embedded in people that have, experienced a tremendous amount of pain and suffering, and repeatedly. I remember being in a clinic and listening to a soldier tell me that he had 3 deployments in the last 5 years, and to think about the psychosocial distress of that, and then not be armed with any tools or techniques or strategies to be able to help address those, was very, it was really, really challenging. And so at my value base was this need and desire to want to help and serve, and yet I really didn't have any capability to do what was necessary to help. So I was really stuck in this biological realm of how do I help folks. And then post-deployment, I had my own lived experience with, a nervous system that was awry and really struggling to adapt back into the civilian sector. And so I had my own lived experience with PTSD and depression, and went through the medical system that loves to tell you what's wrong with you, but really doesn't point you in the direction of hope oftentimes, because we're so focused on really trying to eliminate someone's pain, when in fact we should be addressing the suffering that's being that someone is struggling with within a pain experience. And in fact, what I've come to learn personally, as well as what the literature tells us, is when your life actually feels bigger, your pain feels smaller. And so that's where I've seen personally moving from post-traumatic stress disorder toward post-traumatic growth is a way to help life feel bigger. And so it allows us to have a difference in the lives of the people that we are looking to help. So through my own lived experience is what really brings me here. And it's interesting because I started off with pain neuroscience education like most folks do, and what Cheri does. And then I led myself into a graduate certificate program where I learned in PTOT, health focused care, where I learned about motivational interviewing and how empowering that was for me as a physical therapist, that I didn't feel as much like I took ownership of the process. I restored the ownership of the decision making back to the patient, and then be able to give them the power to make informed choices, and also allow them to fail, and that's okay, and allow them to have grace as they made a decision, and then they learn from that. And I saw that that built self-efficacy for the patients and the clients, and it allowed them to move more, closer to a value-based direction. And so through those experiences, like, I began to shape my own thoughts and ideas about what physical therapy should look like as well. And that led me to really coming into the mental health sphere of treating veterans like myself, and taking my lived experiences and adding additional meaning and purpose to the suffering that I had endured myself. And so that's what led me into this organization, Veterans Recovery Resources. We started in 2018, and we've been able to implement what's called trauma-informed care, which is really a framework that's been developed by SAMHSA, the Substance Abuse and Mental Health Services Administration. And through that, I've been able to take the key concepts of trauma-informed care and move those into the physical therapy profession. And so what that means practically for us is that, one, we recognize, that's sort of one of the big R's of the trauma-informed care, is recognize the prevalence and incidence of trauma. So when you get to digging into the literature around trauma, we see that it's very pervasive. We're moving in and out of a period of time where we don't really know what the effects of a global pandemic are going to be, but we're already seeing that mental health is a priority issue, and there are consequences because of this global pandemic, because of the isolation, because of the times that children are just at home by themselves, parents are working, and they're trying to navigate a school environment, and that's very complex. And these things will be pervasive in the future. And with a behavioral health provider shortage that we have across our country right now in the United States, physical therapists are becoming the de facto mental health clinicians. And the fear, honestly, in that for me is, without the right training and the right tools, physical therapists will experience vicarious trauma that will lead to burnout. And we're already seeing some of that in our profession. So I think that is a rational fear, and one that drives me here to be able to deliver courses on like trauma-informed care, and to be able to educate, to be able to communicate, and build the skills you need to respond to someone who's had a traumatic experience. And then to do that using evidence-based tools to screen for that, to identify for that, then also to be able to develop a consultative network of referring providers. Because like Joe said in the beginning, there's no way you can manage this complex condition alone. And I don't recommend you try to do that alone. So we need other professionals in order to care for folks. And then finally, we want to be able to resist re-traumatization. I think that's another big part of this is there's a way in which we can listen to someone that builds therapeutic rapport, that enhances the therapeutic outcome, and coupled with pain neuroscience education and motivational interviewing, those are key skill sets to be able to bring into this framework of trauma-informed care that says, hey, we're going to take a different approach from you and move you from what's wrong with you to what happened, so that we're just simply listening to what your experience in life has been, determining a value-based direction and moving in that way. And so one, that's been my lived experience. It's what's allowed me to be here today. And so I'm really, really excited to be a part of this course. And I do want to say too, because I'm a part of this organization that delivers this, 100% of the profits that we receive go into developing programs and services for veterans, first responders, and their family members. So thank you.
Okay, thank you, Jeremy. As Jeremy mentioned, the amount of stress, secondary trauma that we experience as professionals, again, another understated aspect of kind of this pain and suffering that we're all interested in, effectively treating. And there's one person who really is at the forefront of that, both in the DPT program with helping PT students, but also then reaching out to her colleagues in other DPT programs saying, hey, I've done research in this area, I developed a whole curriculum around this, and I'm helping obviously student physical therapists, but then also how do we help obviously the PTs, in the field working. So Annette Willgens is at Temple University, professor of PT, strong focus on mindfulness and how we can use mindfulness, both obviously to help people with their pain and suffering, but also how it helps us, right? Because we have to stay strong and healthy and resilient and resist that re-traumatization that we experience sometimes on a daily basis. So Annette, welcome, and happy to introduce you to everyone.
Thanks, Joe. Can everybody hear me okay? Is this a good connection?
Good.
All right. Hello. Welcome. I'm so excited to be part of this course sequence. And so I really appreciate your presence today. The course that I've designed with a couple of colleagues is really about your relationship with anyone that you mentor, either in a formal way or a very informal way. So it's kind of about just everyone around you and how you relate to those people as part of your clinical practice. So if you're a clinical educator or an instructor for a professional program, that's great. This course is for you. If you mentor junior faculty, students, professionals, novices, this course is for you. It's also a reminder for you, for all of us, to take care of ourselves. We can't continue to give from an empty cup. So this course is is quite a passion for me because I did firsthand experience significant burnout, compassion fatigue, vicarious trauma when I did not have the tools. And so passing these on to my students is what I'll be doing for the next 100 years, if I can. By the end of my course, you will learn how to understand how the mentoring process really works with today's student, today's novice practitioner, how they approach the 20-something, 30-something. How do they approach life? How do they approach stress? How do they manage conflict? Do they tend to withdraw? How do they understand stress from the point of the 3 stress axes? And how do the stress axes then affect specific areas of the brain associated with stress, the default way of being, and the way that students today tend to have a bit more distraction and a little bit more mind wandering, so that as we move through this whole process of being a mentor and showing up for one another, can we also teach resilience in these students? So part of the course is that we're also going to create and then address what we call an affective domain diagnosis. So the affective domain is that, that kind of invisible stuff that we don't always see. So how we unpack that the novice practitioner who may be demonstrating behaviors that are associated with stress, but we're not sure how to approach those. Then, of course, we're going to talk about interventions for your mentee in a targeted way, in a very specific and effective way based on some of those discussions. So overall, I just love what Rose was saying earlier about the fix-it mentality. And that really resonates with me because I hear my students saying all the time, we're expected to fix. And in some of the research that Joe and I are completing right now, we're doing some qualitative analysis of some of the work covered, and this fix-it mentality just needs to stop. And that's what these students are being taught in school. So when we see these types of concerns, I think that it's really important to be able to say, yes, this is something that's invisible. but based on the research that we're conducting, we know that young people tend toward 3 different ways of being. These perfectionism, tolerance to uncertainty, and excessive ego involvement. And as we unpack each of these, and these may resonate with you, they certainly resonated with me as I began uncovering these, within myself. And we'll unpack each of them. We'll discuss them in terms of the personality profiles that we can associate with these. And then we'll talk about the difficult conversation as well. You'll feel empowered to create such a diagnosis. And it is important so that we can remain present to one another and remain present to the students that need us and the mentees that need us. In terms of outcomes, my hope is that you'll become really skilled and be able to truly mentor your mentee toward awareness, improved patient safety, improved clinical decision-making, and overall wellness. There will be 10 evidence-based tools that are easily accessible and quick to teach that address the affective domain and this diagnosis that you'll be forming. Overall, what's going on that's new with me is that I continue to do research with Joe. I'm continuing to teach this work both in the clinic and in the classroom. And I think that the most important thing that we can do is to discuss openly things like burnout and fear and imposter syndrome, so that we can stop the silence and therefore stop the shame, because more students than not are experiencing these concerns. So to be my passion as I move forward as an instructor and clinician.
Okay, thank you, Annette. So you've met everyone there. I'm going to share my screen again so I can share some slides back with you. So as many of our instructors mentioned, they mentioned their individual courses. We have put these courses together because we just think they're too important not to be really delivered to everyone. These are really key concepts and methods that every professional who treats pain needs. So obviously, this certification is going to teach you all about the psychological process of pain and how you can use them to treat pain. We find this to be probably the most comprehensive training that's out there that covers a variety of methods that you can use, obviously, in your clinical practice. If you're an educator, you can use it in your classroom as you're starting to develop content for this. Obviously, most people here are teaching. I adjunct at 2 different DPT programs, so we're all teaching as well as using these skills. And then finally, if you're a researcher, every once in a while when I attend lectures and speak at different sessions, people come up to me and they say, I'm interested in mindfulness for PT or ACT for PT or MI in the PT setting. So this will teach you also about these methods and how you could weave them into maybe research that you're interested in. So these are the courses here. You'll see them on the side there. The instructors are here in the center, and then there are the number of weeks for each course. In total, there are about 61 CEUs. So once you're done with this entire process, it's worth 61 continuing education units. And we recommend that you kind of go in the direction that's here on the screen. If you don't want to go in that order, you don't necessarily have to. You can choose any course you want to begin with. But I think it's nice to kind of go in this order because it really provides the foundation and the framework. So each course really builds and leads to the next course. So you can come in at any course you want, but this is the recommendation for each course. There are quizzes built into each course. We do not have an overall comprehensive exam at this time. We didn't feel it was necessary to do that. You're all busy working professionals and you have a good gauge on what you're learning and how you can apply it. But there are small quizzes built in to the course, but no overall final comprehensive examination. This is approved for physical therapists, does meet the credentialing requirements for OT practice, health coaches, and the Institute is currently approved by the American Psychological Association to sponsor CEU events for psychologists and other mental health providers. How does it prepare you? Well, you're really going to learn the latest in psychological, behavioral, and whole health approaches in an integrative way, and that really is the gold standard. And it's really up to date. So Cheri mentioned some things that are happening within the PT realm, both with the guide to PT practice, what's happening in PT school. You know, when we put this together, we said, okay, let's try to exceed those standards because things change so fast. So when you compare what we have here to the International Association for the Study of Pain, or many of the APTA clinical practice guidelines, or as Cheri mentioned, the Academy of Orthopedic and Physical Therapy Pain Education guidelines, we're really exceeding those basics here. So it's another one of the reasons why I wanted to introduce all these instructors and mentors to you, because they're really ahead of the curve. So there's nothing worse than learning information that's outdated. Everything we have here is up to date with the latest evidence, useful for clinical practice. So why this program, right? There's a whole bunch of other CEU courses out there. Well, I think you've now seen that the instructors in this program are what I consider triple threats. So they're treating patients still, they're teaching on this topic, and they're testing or investigating all these topics as well. With that, we've actually tested this content already. So we've been running this now for over a year. We have a 99% satisfaction or completion rate to the courses, which is huge in an online space. A lot of times people buy courses, they don't complete them. What's nice about our courses, we keep them into small bite-sized chunks, so it's easy to go through the material. And then everything is clinic applicable. So whatever you're learning here, you can take to the clinic on Monday and start to use to evaluate and obviously treat your patients. And then finally, we offer a monthly mentorship and coaching session. So one time each month, we get on about a 90 to 120 minute call. And it's not just a Q&A call, but it's really meant to be experiential training where you're now taking these principles and applying them to your clinical practice. So I run those mentorship calls, but I also invite the faculty to come in and speak about different topics. And at times I'll even invite people outside to come in with regard to a key topic. So the mentorship and coaching part is a huge component to our program. People always ask me these top 5 questions about all my courses. Who can register? Really, where we are kind of open arms here. Any health and wellness professional has a place at the table in treating pain. Therefore, any health and wellness professional is welcome here at the Integrative Pain Science Institute. The entire certification takes about 6 months. If you don't complete it in 6 months, if you get busy or you fall behind, that's okay. We don't push people out of the courses. Once you join the course, you have unlimited access to it. I think it's pretty clear that psychological and behavioral interventions are in really everyone's scope of practice. If you're working with people, you're working with behavior change. So any health and wellness professional can use principles of cognitive behavioral therapy. Doesn't mean you're replacing a mental health professional. It just means you're using those principles to guide effective care in patients. When you're done with the certification and you've completed all the coursework and the quizzes, you can have the credential of PIP, which basically means psychologically informed practitioner. I want to introduce you to some other people who are not on this call, but these are our professionals who have gone through our courses and are really doing incredible things. So as I mentioned before, we have professionals from all over the country and from all over the globe. Mary Grant, who's a physiotherapist in Dublin, Ireland, she really has, she's completed all the coursework, but she's really taken to the mindfulness and ACT courses and really is the center of her care in treating people with rheumatic conditions in her practice. Some other professionals, Dr. Andrea Moore, who came in with a strong background in orthopedics and has taken all these psychologically informed approaches, but she's whittled them down or kind of distilled them down to helping people with perfectionism. She struggled with perfectionism in PT school, and now she treats women at the intersection of perfectionism and chronic pain. So people have taken the coursework and really made it specific to what their clinical practice is or what their subspecialty is. Michael Zabala-Aquino is a physical therapist in California. owner of Deconstruct Health. He focuses on chronic pain, but specifically pelvic pain in men and women. So has taken this and kind of geared it toward the pelvic health conditions. So some more reasons why you may decide to learn and join us. We have more methods in this program than any other program that's really out there. We've done our homework. We go way beyond just pain science, so to speak. We've really taken these methods and include them all together. We are cheaper, which is always nice and important. And then just to kind of top that off a little bit today, if you're on this webinar, we have discounted the entire certification by 10% for those of you that have joined us today. So I'm gonna take questions now, but I'll just go back to this slide real fast and just show you what's included. You know, of course, I teach the ACT and the mindfulness-based pain relief courses that are part of that certification. Really, ACT and mindfulness just blend so well with the trauma-informed care and the MI, and of course, it has strong roots in pain science, and a lot of that will carry over into the mindful clinical mentoring that Annette has created. So we have, you know, really linked these together like a puzzle. ACT and mindfulness really starts to show you the difference between pain and suffering, which is a key component of psychologically informed care. So that's what's focused on in those two courses. With that, I'm going to look at the Q&A and just start to address some questions. Okay, Brian asked, Joe, this sounds amazing. Are these courses sold separately or as a bundle? If together, what happens if I already purchased one of them? So you can purchase them as the complete bundle that we're offering today for 10% off. You can take each course individually. As you take each course individually, obviously you'll complete and check off the boxes for the entire certification. So you can choose individual courses or the entire certification. Obviously, the entire certification is more affordable. So if you buy the certification today, you can tackle those courses at any time you get to them, basically. Dana, kind of similar question. If we've already taken one course, is there a credit for the overall price? Our pricing is as is on the Institute website right now. So if you go to the Institute website, that is the pricing. How many hours of training in the course? It really depends on which course. I've kind of listed them out there on the side as far as number of weeks. Overall, it's about 60 CEUs. They're not necessarily evenly dispersed. There's a little bit more on the ACT and mindfulness pieces than the others, but ACT really is kind of becoming the third wave cognitive behavioral intervention of choice for chronic pain, along with mindfulness, which is why we've kind of geared it that way. And I think those are all answered. Anything else in the chat thread? I think that's most of the questions there. Anyone else have any other questions? You can put it in the chat thread, or you can put it in the Q&A there below. I think someone raised their hand. Let me see if I can find that person. Hold on one second. Hi there, can you hear me? Hi, Jill. Well, Jill was there and then she disappeared. If you want to raise your hand, you can raise your hand. I'll try to unmute you.
Hi, this is Jill.
Hi, Jill. Welcome.
Great introduction to your course. When does the course begin?
It begins today. You can begin at any time. Yeah, our registration is open for the next week or so for the 10% off, and then registration will close in about 10 days. Each individual course will be up there after that. But with the advantage of purchasing them today is that you have that discount. As I mentioned before, like we've done our homework. There are other I would call them pain informed certifications out there. They're upwards of $5,000. So we've discussed price. We still discuss price constantly. We want to keep things obviously affordable, but we also don't want to undersell ourselves. We'll probably raise this over time because it's just too valuable. But for today, know that that discount's there for you. Someone asked about coaching. So the coaching sessions are group. They usually happen on a Saturday about 11 o'clock Eastern time. They are recorded. So if you missed them, you can go back and view them. I have tons of previous coaching calls available to you as well. So if you just wanted to spend, hours looking at coaching calls, all those are pre-recorded or previously recorded, and you have access to those as well. So something in there about biomarkers with regard to pain specifically. We don't have a specific biomarker for chronic pain. People are still looking for that. We have a collection of different biomarkers. So there's really not just one specific biomarker with regard to pain. It's really a collection of different biomarkers. So, looking at both conventional biomarkers as well as functional medicine biomarkers, that does help people. Yeah, so Michelle, you purchased 5 courses. So we recently added Annette's course to this. I think it's invaluable. If you purchased the certification previous to this and it didn't include that, then we will extend certification to you. But anyone going forward will need to complete Annette's course. The reason why is because there's a really pro-social aspect to that course. It's really, how do I take the information that I've learned and now not just treat the patient one-on-one, but how do I start to share that in my clinic, in my community, and outward. There's a huge, think of it this way. Even if we all started treating chronic pain all day long, we wouldn't be able to really kind of turn the boat around on what we currently have. We have, in the United States of America, at least, we have such dire needs for physical and mental health interventions, which obviously this fits into, but we have to start to bring that information to the public. Treating people one-on-one, super important. We will always get better at doing that. All of us here are constantly involved in learning and just learning throughout the lifespan. But we have to, like Jeremy, for example, is involved in training peers. You may decide to take this information and train peers in your community or in your church group, wherever that is. That's really a key way to help turn our chronic health pandemic around. And Annette's course is really key in that. All the courses will help you with that, but then you kind of get to Annette's course and she really sees how you can apply this to bigger groups. And there's really an important component there. Let me see, there's something else popped up here. Yeah. Michelle Chung, if you have any questions, you can just email. And anyone, if you have questions specifically, you can email support@integrativepainscienceinstitute.com. And we'll be happy to answer those. Anyone else? Let me see if there's any more hand. Anyone else want to raise their hand and chat with me directly? Love talking to people directly. Anything else any of the faculty and mentors want to mention or discuss before we close?
Yeah, I'd like to chime in just real briefly on what you just mentioned about how we change the course of how pain care is provided. I think there's, the opportunity at the individual level where we're one-on-one with someone in a clinic setting, and then we transform someone's life and that person's life is transformed and they can go help others. That's how you influence a community. And then ultimately the community leads up into how policy is changed. And so it's really a bottoms up along with tops down approach to changing how pain care is provided. But it takes a lot of people to be involved. So just that's what I want to encourage everybody. We're all part of the solution. And it's our ability to influence and lead others toward that solution that is ultimately going to make a difference.
Mm-hmm. There's a couple of questions here in the chat and the Q&A. I'll address those. Any techniques that reduce fear of pain on chronic low back pain? I mean, really, this entire certification will give you really a plethora of tools and interventions to both evaluate and reduce fear. That is a big component of chronic pain. So everything, the pain education course does that, MI does that, trauma-informed care does that, all the mindfulness and ACT-based courses do that really effectively. Dr. Debbie Silverman asks, is there a time limit on how long you can take to complete the components? No, we know you're a busy professional, so we have not placed a time limit on this. I think that's just challenging. So we recommend that you set aside some time each week, maybe about an hour and a half, and really treat yourself to some really great evidence-based coursework on pain and work through it. If you work through it each week for about an hour or so, you'll be complete in 6 months. But we realize holidays happen and birthday parties happen and vacations happen. So you have unlimited access to it. Let me just hop over to the Q&A, see things in there again. So Fabio asked, how can I use a discount? So Fabio, it's already taken off on the checkout page. You don't have to enter a code or anything. I've already discounted it so to make it easy for everyone. So you'll see that price when you check out. Are there books to buy? I bought your book, Joe, but I wonder if there are other texts used in this course. So Margaret, just hang on a couple of months because I have a textbook coming out and it's called Integrative and Lifestyle Medicine in Physical Therapy. And it covers kind of the foundational topics that we talk about in this certification, but it actually goes beyond that. So it will be a companion to this certification. But of course, a textbook is a textbook. Here you're getting, obviously live training basically, which is, invaluable. And most of almost everyone here have contributed to that textbook. So the textbook is not the same as the certification. Obviously the textbook is, it's more didactic. The certification really goes into the how-to elements where the textbook is really based on more theory. Adriano, if you have questions about currency, you can email support@integrativepainscienceinstitute.com. That's support@integrativepainscienceinstitute.com. The currency on the page there you see is the US dollar. Anyone else? Did I get everything? Anyone else from the faculty? Final questions or comments? No? Good. We're going to wrap then. So, did something just pop up here? Someone asked about measures. We do have objective measures all throughout the program in all the different methods we're talking about. So in every course, we have objective self-report measures that you can use with your patients. Yep, that is part of the complete certification, of course. Pre and post measures, yep. Are there future updates on course with the people who bought it earlier? So if I up any course at the Institute, if we make an update to it, you have access to the update. So as we update the courses, we don't charge you more or an extra fee. We don't charge you a yearly fee. As we update courses, you have access to those updates. As I mentioned before, we're all confident that everything we have here is very, very up to date, way more than you'll probably see in most other continuing education offerings out there. And that's why I mentioned kind of like everyone here is a triple threat. They're using it to treat patients. They're teaching this obviously in the PT program and outside the PT program. And then they're investigating it. Annette mentioned that her and I really did a quite large investigation this year, which we'll be sharing soon. It'll be published on ACT for physical therapists and chronic pain. I can't wait to share that. I think it's going to change a lot of what we do as PTs. And in that study as well is how not only PTs found ACT to be acceptable to use in PT practice, but also how it helped with their psychological flexibility, basically their burnout and stress. So we'll be sharing that in the months to come. If you're on my email list, you'll receive notifications. Some week I just send a basic email about my podcast. Other weeks I send more emails about courses and offerings. So just make sure you're on the email list. If you're not, just go over to the Integrative Pain Science Institute.com and just opt into any box there, enter your name and email address, and you'll be on the list. Thanks so much, Anne. We appreciate your feedback. Anne just saying she appreciates all of your work in pioneering this approach. We appreciate you too for being here. All right, everyone, I'm going to close. If you have any questions, again, just send an email to support@Integrative Pain Science Institute. I want to thank you all for being here on a Saturday. Thank you to all of our mentors, and we look forward to meeting you and learning with you in the future. All right, everyone, take care. Bye-bye.